Hi students, today let's discuss regarding tympanic membrane perforation. So the definition of tympanic membrane perforation, it is a hole or rupture in the eardrum. So tympanic membrane is otherwise called as eardrum. So tympanic membrane perforation means there is a hole or the rupture of the eardrum can be happened. So we should know what is tympanic membrane. It is a membranous which separates the middle ear cavity from the external ear pathway and transmits sound waves to the middle ear. So tympanic membrane itself is a membrane which is acting as a partition between the external canal and the middle ear. So as well as it can transmit sound waves from the external ear canal to the middle ear. Okay. Then tympanic membrane perforation is seen as partial or total rupture of the ear membrane. So tympanic membrane perforation എന്ന് പറയുന്നത് ഇയർഡ്രമിനകത്തൊരു ഹോൾ കാണുന്നു അല്ലെങ്കിൽ അത് കംപ്ലീറ്റ്ലി റപ്ചർ ആയി പോകുന്ന ഒരു അവസ്ഥയാണ് tympanic membrane perforation എന്ന് പറയുന്നത്. So tympanic membrane perforation is otherwise known as perforated eardrum. കാരണം eardrum എന്ന് പറയുന്നതും tympanic membrane എന്ന് പറയുന്നതും സെയിം ആണ്. Okay, so this is a picture which shows the clear idea regarding the normal eardrum with a ruptured eardrum. So here you can see that the eardrum is not having any forms of holes or perforations, but in the right picture you can see a hole at the lower margin of the eardrum. Okay, so this is another picture which shows a tear in the tympanic membrane. Okay, so this is tympanic membrane perforation. The main etiology, first is infection, which include acute otitis media and chronic otitis media. We had already discussed regarding these conditions very detailed in the previous sessions. So acute otitis media means it is an inflammation of the middle ear, which is sudden in onset, and this perforation is usually situated in the anterior inferior quadrant of the eardrum. So due to this acute otitis media, patient will develop perforations in the tympanic membrane. The anatomical position of these perforations will be in the anterior inferior quadrant of that eardrum. Then chronic otitis media, these perforations may be central or marginal, because chronic otitis media means it is a chronic infection of the middle ear. Middle ear chronic infection is chronic otitis media എന്ന് പറയുന്നത്. അതിന്റെ പ്രത്യേകം ഒരു ഫീച്ചർ എന്ന് പറയുന്നത് സെപ്പറേഷൻ ആണ്, which means there will be more pus production. So this pus can be cause increased pressure in the eardrum. So in the later stage, it can cause perforations in the eardrum. So it may be central or at the marginal level. For the holes can be seen either in the central part or in the marginal area. The next, first is infection, next is trauma, which means due to hairpin, matchstick or unskilled attempts to remove bags or foreign bodies. So when we were discussing regarding the foreign body removal, I think this is the first class of this unit, we had discussed regarding this foreign body removal. So when we are trying to remove these kind of foreign bodies as well as the bags, it should be done by a trained person, or else it can lead to severe damage to the eardrum. So accidental trauma can be happen to the eardrum while trying to remove these forms of foreign bodies from that ear. Then sudden change in the air pressure, which can be happened either on while slapping on the ear, forceful valsalva may rupture thin atrophic membrane. Then pressure by a fluid column, example diving, water sports, or forceful syringing. So in our middle ear, the pressure will be managed by the patent eustachian tube, isn't it? So any form of conditions within the eustachian tube can be resulted in changes in the pressure, so that it can cause sudden change in the air pressure and leading to a perforation or rupture of the tympanic membrane. Forceful syringing, it is one of the management in removing the foreign body or to remove the impacted bags. We can perform this syringing, but it should not be done by forcefully because it can rupture or damage the eardrum. So when we were discussing regarding this impacted wax, we had already discussed this reasons as well as the management. Okay. Then high pitched sound, the frequency or if you hear a high frequency sound, automatically it can damage the eardrum. Then fracture of the temporal bone and foreign bodies and malignant tumors in the middle ear. So it can be leading to act as uh, a cause for getting perforation due to the increased size of these tumor cells within the middle ear. It can cause increased pressure in the tympanic membrane, and at the chronic stage, there will be perforations that happen in the eardrum. Then iatrogenic interventions. If you are trying to remove certain ear wax from that patient's ear, or if you are trying to remove these foreign bodies, then also the eardrum can be damaged, or if you are performing any form of surgical management in the middle ear by through incisions, there may be some kind of accidental incision that can be happened within the eardrum. Then also the patients can be get a perforated eardrum. So these are the main cause of perforated eardrum. The types of perforations. So when we were discussing regarding chronic otitis media as an infectious cause, we had seen the central and marginal type, isn't it? So the types of perforation is divided into three: central, marginal, and ectiform. So in the name itself, we get an idea that what exactly it is. Central means what the hole can be seen in the central part of the eardrum, and marginal means at the marginal portions, and ectic means which is the superior portions of the eardrum. So I will explain in detail. Central perforation means it is the one which is surrounded by the eardrum all around. So this hole can be seen in the central part of eardrum. Automatically, this hole will be surrounded by the remaining portions of that eardrum. Then marginal perforation. It occurs at the margin of the eardrum, usually in the posterior superior quadrant. Posterior superior quadrant. So the eardrum does not encircle the perforation all around. ഒരു മാർജിനിലേക്ക് ആയിട്ടായിരിക്കും ഹോൾ കാണുന്നത്, കാരണം കംപ്ലീറ്റ് ആയിട്ട് ആ ഹോളിനെ എൻസർക്കിൾ ചെയ്യാനായിട്ട് അല്ലെ പെർഫറേഷൻ എൻസർക്കിൾ ചെയ്യാനായിട്ട് ഇയർഡ്രമിന് സാധിക്കുന്നില്ല. Then ectic perforation means this is a perforation in the superior part of the eardrum. So this is the form of hole that can be seen in the superior portion of the eardrum. It may be associated with a deep retraction pocket or called as teardroma into the mastoid, so that we can perform or we can expect these forms of perforations in the chronic stage of otitis media. Because we otitis media discuss there are mainly two forms of otitis media. First is benign or tubertympanic. Otitis media, chronic otitis media discuss in the സമയത്ത് discuss classification. It's divided into benign or tubertympanic. Then the second is dangerous or eticoenteral. So this group of infections can be manifested by the presence of cholesteatoma along with ectic perforations of the tympanic membrane. Okay. Then this is a picture of marginal perforations. You can see perforations at the margin of that tympanic membrane. This is the tympanic membrane. Then, so it's the picture which shows the three forms of or types of tympanic membrane perforation. This is central perforation. So you can see that this is very small in nature, so that the entire portions will be surrounded by the eardrum. So this is marginal. The hole can be seen at the margin of the eardrum. So the remaining portions cannot be encircled completely. Then this is ectic perforation, which can be seen in the superior part of that eardrum. Then size of perforation. So there may be varying sizes of perforations. The size may be small, moderate, or large according to the severity of infections. In the initial stage, patient may be having a small size of tympanic membrane perforations. As the infection increases, patient may develop a large forms of perforations due to the increased pressure of that pus within this middle ear. Okay. Then very large perforations may be total or subtotal. Large perforations are total perforations അല്ലെങ്കിൽ rupture ഒക്കെ സംഭവിക്കാൻ സാധ്യതയുണ്ട്. Then this is this picture which shows this, different sizes of perforation. This is very small eardrum perforations. Okay, you can see that. This is medium, or when comparing with this small perforations, it is large. Okay, this is very large perforations. Okay, so it can be seen in the later stages of chronic otitis media. Okay, so in this picture you will get the different sizes of perforation. This is small, then this is medium sized, and this is large. Okay, then the clinical features, how this patient can manifest the signs and symptoms along with this perforation. Automatically patient will develop conductive hearing loss because from the external auditory canal the sound waves can be transmitted to the middle ear through this tympanic membrane. So once it is perforated, this can be cause the blockage of this sound waves, so that patient will develop hearing loss, but it is temporary in nature. Then other symptoms like tinnitus, which means ringing sensations in the ear, then earache or otalgia can be happened, then vertigo due to the imbalance or vestibular functioning impairment can result in vertigo, then ear discharges. Ear discharges, as per the patient's infectious status, the ear discharges can be of different forms. Like in the initial stage, it may be of mucus type or serous type, and in the later stage, it will be blood stained or severely purulent in nature. Okay. The nausea and or vomiting secondary to vertigo. So these are the clinical features that patient will exhibit in case of a perforated eardrum. The diagnostic methods. In the history collection, we can collect the history regarding whether the patient has any history of ASOM, which means acute suppurative otitis media and chronic suppurative otitis media, and patient had undergone any forms of iatrogenic interventions to remove foreign bodies. And also we can collect history regarding whether the patient had any history of impacted wax or foreign bodies. So these data should be collected from the patient, as well as we can collect history regarding the clinical features like otalgia or the ear discharges, the color of ear discharge, whether it is bilateral or unilateral. So these data should be collected from the patient. Then physical examination, we can assess for the hearing ability of that patient, as well as we can perform the tuning for a tuning test like Rinnet test, Weber test, etc. Okay, then otoscopy. To microscopically, we can perform the visual examination of the tympanic membrane for an rupture or perforation. Then audiogram. It is also to assess the hearing ability of that patient. Hearing ability can be assessed. Then tympanometry. So these all things we had already discussed in the diagnostic evaluations of the ear. Okay, so this is a picture of how we can perform this otoscopy. For that, we have to get an otoscope. Through this, we can evaluate. So this is a normal eardrum. There is no forms of any perforations or hole that can be seen in tympanic membrane. But in the right picture, you can see a hole in the tympanic membrane. It is very evident when we are performing through this otoscope. Then how we can manage this condition? General measures that we can perform that keep the ear clean and dry. Because if the patient has any forms of perforation, automatically the water can be entered into the internal structures, so that it can activate the infection. So always we should try to keep the ear clean and dry. And apply warm compress to get relief from pain. So in the severe forms of eardrum perforations, patients will be having severe otalgia. So to manage with these forms of otalgia, we can get the help by applying a warm compress. Then avoid swimming. While swimming, sometimes the contaminated air, if you are trying to, or if swimming is performed under the contaminated water, automatically the water can be entered into the ear, and through these perforations, this water can enter in the middle ear as well as to the inner ear, and it can aggravate the infections. Then plug the ear with cotton while showering. So it is another precautions that we can take while taking the bath to prevent the escape of fluid into that ear canal or middle ear. Then, most eardrum perforations heal spontaneously within weeks after rupture, although some may take up to several months. During the healing process, the ear must be protected from water and trauma. Eardrum perforations that do not heal on their own may require surgery. Automatically, if small cases of eardrum perforations can be healed within weeks or within several months. So if it is not healed well, we can select some surgical management to cross this perforation. So for that, we can perform one of the methods, that is Myringoplasty, which means this is the repairing of the perforated tympanic membrane. So if a hole is in the eardrum is small, it can sometimes be repaired by Myringoplasty. This is performed by irrigating the margins of the perforations and then giving it some sort of template to grow across. This template may be as simple as a piece of secret paper placed over the roughened edges of the hole. More often, however, a small piece of tissue such as a piece of fat can be placed through the very small perforations and result in a successful closure. So Myringoplasty means it is a repairing of perforated eardrum. Okay, for that we can get a graft either in a form of piece of secret paper or a piece of fat. So it can be attached to the over the tympanic membrane perforation. So this is the picture. This is very small in nature, and we can apply a patch. Secret paper patch, sterile strip, or silk patch is applied to the lateral surface of the tympanic membrane. So this is a clear picture of how we can use paper patch Myringoplasty through this. We can cause this opening. Then tympanoplasty. Tympanoplasty means it is a reconstruction of the perforated. It is a reconstruction of eardrum, perforated eardrum. Okay, if a hole is in the eardrum fails Myringoplasty, or is it too large to repair with Myringoplasty, then tympanoplasty is required. So Myringoplasty will be effective if the size of the tympanic membrane perforation is very small. But if the size is very large, we cannot perform this Myringoplasty. Instead of that, we can perform this tympanoplasty, which means it's a reconstruction of the eardrum. It is often performed by trimming the margins of the perforations and creating a patch out of the covering of the temporalis muscle above the ear. Temporalis fascia is primary graft that we can use to reconstruct this tympanoplasty. The eardrum can also be repaired using the tough covering of the cartilage of the ear called perichondrium. Either we can use the temporalis fascia or else we can use the perichondrium. Okay, so this is a picture of tympanoplasty. Before, this is the perforation, and after that, we can completely reconstruct this perforated tympanic membrane. Okay. So this is a picture of graft tissue is taken from the temporalis fascia. From this area, we can take this graft and attach to the perforated eardrum. So, this graft the size is very large. Okay, so that's hole. Okay, so in this session, we have discussed regarding what is eardrum perforation or tympanic membrane perforation, its definition, its classifications, or the levels, which means central types of perforations, which means central, marginal, and edgy, and the sizes can be of varying sizes like small, medium, and large, and we had seen different causes that can be leading to the eardrum perforations and what are the diagnostic tests that we can perform to rule out these tympanic membrane perforations and how we can manage. So if normally these tympanic membrane perforations can be healed within several months, several weeks or several months. If it is not healed well, we can perform the surgical management like Myringoplasty as well as tympanoplasty. I hope you got an idea regarding this topic, and if you have any doubt, you can ask me at any time. Okay, thank you.